Hi, and in this one, we're continuing with the pathology of cardiovascular disease, Carrier 2.7, by looking at the peripheral vascular diseases. So previously, we talked about the atherosclerosis and the disease process happening to the arteries supply the heart or the brain. So the peripheral vessels is the same damage, this narrowing of the arteries due to atherosclerosis, and any other of the vessels. So most commonly, this is the arteries that supply the leg, making it quite a painful condition due to the lack of oxygen reaching the leg muscles. Another good example is deep vein thrombosis. This is the first time we've seen this process happening within a vein. So we've got a blood clot forming in one of the deep veins, again, most commonly with leg, usually the calf. And this can be really, really dangerous because potentially part of that clot, part of that thrombus will break off, travel in the blood as an embolus, and then block off another vessel. So one of the more common ones is a pulmonary embolism, so where blood supply is cut off to the lungs, and that's always a dangerous and life-threatening emergency. Okay. So let's try out a past paper question. Got a problem-solving one here. So pause the video, have a read through, and come up with your response. So we've got a data table here to work with. We're told hormone replacement therapy is used by women to relieve symptoms of the menopause, which usually occurs from the age of 50. So a study was carried out into the effects of HRT on the health of 12,000 women. They were separated into three equal groups according to their age. Half the group took the HRT tablet, while the other half received a placebo, so a non-active uh, version. Then, over the next 5 years, the number of women in each of those groups who developed either a pulmonary embolism, which is a consequence of DVT, or coronary heart disease was recorded. Okay. So we've got age groups, the, who was given the drug, who was given the placebo, then the numbers who developed pulmonary embolism, and the numbers that developed heart disease. Okay. And you were asked to describe two trends shown by the results for the pulmonary embolism. Okay. So, two marks, two trends we need to pick out. So, we can look at what's happening in the different age groups, what happens as age increases, and also compare those taking the HRT to those who are taking the placebo. Okay. So for one mark, so the number of cases of the pulmonary embolism, they always increased with age. So for both groups, it was higher as the age increased. Do not accept answers that focus on one specific age group. You're looking for trends, for patterns, so we're looking at the overall picture here. And then for the second mark, you're comparing HRT to the placebo. So the number of cases is higher those who are taking HRT compared to those taking the placebo or not taking HRT. Okay. Again, you must make that comparison overall. Okay. So, any other questions? Anything you need me to clear up? Please just say.